Top Med Talk.
Well, hello and welcome to Top Med Talk, broadcasting live from Singapore for the World Congress of Anesthesiologists, hosted by the WFSA, the World Federation of Society of Anesthesiologists. Now, this event marks a very significant milestone as the first in-person meeting in 8 years. And I don't know if these are the most numbers they've ever had, record numbers, but I've heard that there are over 5,000 delegates present from over 140 countries worldwide.
That's amazing.
It's really cool.
Yeah.
Very, very cool. Now, in true Top Med Talk fashion, we find ourselves here in the bustling, been engaging in conversations with colleagues from around the world. It really is so nice to reconnect with our friends and the familiar faces that we've seen year after year at all these global meetings, but really forge new connections. I have met some outstanding anesthesia professionals from countries that, Pakistan, the Middle East, Africa, all over the world. It's been very, very cool. So diving right in is really a continuation of some dialogue that we've been having here on Top Med Talk about women in anesthesia. Now, building on multiple previous discussions, the last one being in Dingle, Ireland for the EBPOM Ireland conference back in the fall. We talked to Bobby Jean Schweitzer, Kate Leslie, and Anoushka Afonso. Now, today we are thrilled to be able to continue that conversation. We have Kate Leslie and Anoushka Afonso back with us today. Ladies, thank you so much for joining us again.
Well, thank you. It's quite a different environment than Dingle, but
that meeting is so intimate and great where we can all, enjoy each other a little bit more in a different way, where we're not having to be here in the big exhibit halls and give, presentations to 1,500 people. We're talking to a lot of our colleagues that are also friends. So really good. But thank you guys for joining me again. Anoushka, I want to start with you. For those who may have not heard that last podcast that we did, can you tell us a little bit more about yourself, some of the things that you're doing up in New York?
Sure. I wear a couple different hats in New York. For one, I head up the Enhanced Recovery After Surgery Services. So I'm the director of the ERAS programs, helped set it up for the last 7 to 8 years. So from infancy. So we have multiple clinical programs running in both our main hospital and the ambulatory center. So that's one hat. The second hat I wear is I'm the faculty program director for our Memorial Sloan Kettering pipeline research program for medical students and high school students. So over the summer, it's an application process. So we have about 20 medical students and 20 high school students, and we pair them up with mentors over the summer, get research experience, teach them how to do presentations, write papers, PubMed, and they are expected to have a final presentation by the end of their 8 weeks. During that time, we expose them to what is new at Memorial Sloan Kettering, cancer care, all the innovative people there, and some of the research being performed there. So they get that exposure of what it is to be treated as a cancer patient, how to take care of a cancer patient from A to Z, as well as the nuances such as financial toxicity, disparities in cancer care. So everything from bedside to bedside and bedside to bedside. So it's a very comprehensive program that we create for these kids over the summer. So that's for the medical students. And for the high school students, we allow them for some mentorship. And again, they're at high school level. So they come in, they see that they take part in courses of, how to resuscitate a patient. So with a dummy, a model patient, get exposure to some of the different other aspects of healthcare careers, not just physicians, nurses, but others as well.
That is incredible work that you're doing there, that in addition to your day job.
Yes, the clinical realm, I mostly work with the GYN and colorectal services.
Do you do a lot of clinical research yourself? Are you much into that space?
I do. I enjoy clinical research. So I have a couple things that I dabble with in the field of perioperative medicine and outcomes in cancer patients. And then more recently, physician well-being, wellness, burnout. So we published a couple studies with physician burnout and anesthesiologists.
Wow, that is absolutely fantastic. Well, Kate, I know many people know you as well. And you've been on Top Med Talk quite a bit. You've been on a very special guest and a friend of the family for a while.
It's been great.
It has. We've had so many wonderful conversations over the years. But for those people who are listening that may not have heard any of the podcasts that you've done before, tell us a little bit more about yourself and some of the work that you're doing.
So I'm in full-time clinical practice as an anaesthetist still after all these days.
I don't know how you do it.
No, well,
I don't know either.
I love it.
Yeah.
It's great. And I'm doing my research, leading some big clinical trials.
Yeah.
I continue to be one of the only, senior women in that space.
Yeah.
I'm happy that I've been able to be a role model to other people, but it's a long and arduous process, for people to get there, and I'm trying to support people as much as I can.
Yeah.
And the main way I'm doing that at the moment is through my role as an editor of the BJA.
Yes.
So it's a privileged position that I have, which I can assign reviewers to papers. I can solicit manuscripts. I encourage people to write editorials and letters, and it's been my personal quest to ensure that I have at least 50% women involved in all of those different processes. And it's interesting. It hasn't been that difficult.
Yeah, that's what I was going to ask.
Yeah, I thought that it might be hard to find women who are keen to contribute, but it isn't. And one of the joyful things is you find gold just by accident in the reviewer database. I found this fantastic woman in Los Angeles. Lisa Lee is her name, and she just does the best reviews. We've never met. I hope we do.
Yeah.
And there are numerous other women that senior and emerging, who I'm trying to include more and develop their capabilities in the publishing space.
Yeah.
So it's been super fun.
That sounds like a lot of fun and wonderful work, and congratulations on that, because it is hard. And as someone who has worked with in meetings and working within trying to promote and bring women into the fold, you hear a lot of pushback from colleagues saying, "Oh, there aren't women that want to do this. It's really hard to find women." And you kind of hear these excuses, and it sounds like that's not been your experience at all.
Well, I think women are much more likely to respond to an invitation with an explanation of why they can't do it. They, tend to respond promptly. Yeah. I've got 25 other things I have to do by next week.
Yeah.
So they're polite,
Yeah.
and not that the chaps aren't polite either.
Yeah.
But, I think that by doing that, they're expressing their desire to be more involved.
Yes.
Later. And at this meeting, I've met some wonderful people, as you have, from places that I don't usually get exposed to. I just had a great chat with some wonderful anesthesiologists from Africa.
Yes.
Who are keen to get into the publishing process. So that should be good. We'll find something for them to review or to write about, and it snowballs once they get going, doesn't it?
Yeah, absolutely. Now the BJ, we actually did a conversation with them, or a series back. Gosh, it was before COVID, before COVID. When they had they had a series going on women in anesthesia, and it really has been fascinating to see how pushing that forward and making sure that they're continuing to keep that at a forefront. Has that been a focus of the journal specifically?
Yes, it has. With the support and encouragement of our publisher, Elsevier, we have instituted a number of things, asking all of the people who interact with the journal to disclose their gender and sex.
Yeah.
And it's not compulsory.
Yeah.
But nearly everybody does. So once we have that info, we'll be able to do not individual analysis, but broader analysis about how we're going, attracting diverse racial and ethnic groups, as well as diverse genders to interact with our journal.
Yeah.
And the data is where it's at when you want to make change, isn't it?
Yeah, absolutely. we're diving into this topic, but I really do find it fascinating. When you go to find reviewers, because I'm sure there are many people who are listening to the podcast right now who would maybe want to put their hand up but never been asked. How do you go about finding people who want to, get into this space?
Well, I've had personally, I can only speak for myself. The reviewer databases at these journals, you can't search by gender.
Oh,
so that you have to try and work it out other ways.
Mm-hmm.
And there is an inbuilt bias there of a white Australian woman trying to find female reviewers from countries where I'm not familiar with their names.
Yeah.
So it makes it really difficult.
Mm-hmm.
But at conferences like this, I go to talks. I try to find women who are good at talking.
Yes.
And look them up, see if they've published something. And then, women and other people, all sorts of people, men, come up and say, I'm really keen to review. Can you send me a paper? And so we've got plenty of papers.
Yeah. I'm sure you do.
And our acceptance rate is, pretty low, like all of them.
Yeah.
So there's plenty of material to review. And we can always do, put people on as an additional reviewer.
Yeah. Wow, that's really, really cool. Anoushka, from your perspective, I mean, you said that you are into research and enjoy that. And you are also mentoring people behind you. What are your thoughts kind of on some of the things that Kate's talked about?
I think it's fabulous. I commend Kate for all the work that she's doing. I had no idea the extent of what she had been doing. So it's really nice to sit next to her, even though I was, having a drink with her, in Dingle, and now here, just really understanding the amount of work it takes to do what she does.
Yeah.
I think there's a lot of backstory to getting for Kate to get where she is. A lot of hours and a lot of sweat goes into that. So
particularly here in Singapore.
Oh my God.
Yeah.
Even more, I think.
But I definitely commend Kate for everything that she's doing and her desire to elevate women and including them more in the research sphere.
I think those are some of the things we're not necessarily talking a whole lot about as a community. Whenever we talk about women in anesthesia, we talk about promotion and getting them into leadership spaces, but really bringing them into the arena of research, I think is something that probably need to continue. I mean, is that your thought, Kate? I mean, you're in some of these meetings and some of these other organizations. Do you feel like there is a movement towards promoting women into the field of research?
Oh, totally.
Yeah.
I think I continue. I grow more and more optimistic.
Yeah.
I'm naturally optimistic.
Yeah.
I'm more optimistic. all the major societies of anesthesiology in the global north and south now have, programs to promote diversity.
Yeah.
There's 2 terrific sessions this morning with people from all over the world talking about this issue.
Oh, great. Gosh, I missed that one. I wish I could.
There's so many great sessions to go to.
I know. That's the thing. There's I heard there are over 500 faculty for the meeting. So that means that there's a lot of content here. I think we can catch some of that afterwards. So I recently participated in a Women in Anesthesia and Leadership panel at a conference that I was at. And some really interesting themes came up that we have not necessarily talked about. I kind of wanted to get your all's perspective on this, on these particular things. I think the first thing, and we might have touched a little bit in Dingle about this, is leadership styles and how, maybe what the difference is between a stereotypical man-woman, but really just focusing in on how we as women lead a little bit more, a little different than our colleagues. So, Kate, I wanted to get your perspective on this because clearly you have been a leader in anesthesia and done amazing things over your career. Can you tell us a little bit about your style?
It's always hard talking about yourself, I find, although I love it, obviously. I think it's worth reflecting on your style.
Yeah.
And also having a little bit of, understanding of yourself and how you work. And and the sort of person you are. And that takes work over many years, reflecting, reading, talking to other people about that, because I don't think you can decide on a leadership style.
No.
The leadership style comes to you based on your progress through life.
Yeah.
So I think my leadership style has changed over the years. Command and control was a favourite leadership style of mine earlier.
I love it. I love it.
I think to be inspiring, to try and, make people feel like they want to do all the hard work that's necessary for the organisation you're working with.
Yeah.
And that they're not begrudging of the hard work they do, because they know that you appreciate what they're doing and you're celebrating their success, and you're communicating with them about how things aren't going so well, not in public, but in a supportive environment.
Yeah.
Like a lot of female leaders, I'm highly organised and totally prepared. Like Anoushka talk this morning, the most beautiful slides, clearly all of the effort that she put into her is emblematic of the way that a lot of women approach leadership, which is to not do it until they're totally prepared, and to be the most prepared person in the room.
Yeah.
Is a common leadership style, and that's my style as well.
It's interesting that you say that. That is so true. But do you think we're a little hard on ourselves sometimes?
Oh, yes. I mean, I should have put my slides together on the plane and just winged it, but I never do that.
You prepare way ahead.
Usually.
Yeah. Anoushka, what are your thoughts on her?
So I think a lot of what Kate said resonates with me. I think, when you talk about leadership style, I think that really depends on who you're talking to and how that synergy is with whoever you're managing or leading. And as Kate mentioned, it does change over time. You mentioned, Desiree, just different styles in terms of men and women and earlier on versus later on. It just reminded me of a book I read in undergraduate by Deborah Tannen. It's about how men and women communicate very differently, and where women, it's a more circular approach, and men, it's more hierarchical.
Yeah.
And so I think we tend to really want to know how the other person's feeling and what their thoughts and actions, and bring that emotional intelligence into it a little bit more. So be willing to listen a little bit more than talk.
Yeah. I want to talk. Oh, I'm sorry.
No. I think that's a key point that I generalizing, but I think most women try to do the best that they can and get everyone's point of view and input before making a decision.
I want to talk about emotional IQ here in just a second, but Kate said something about the evolution of her style. You're getting ready to take on a new leadership position for ACER, correct? Can you tell us a little bit more about that organization?
Yes, the American Society of Enhanced Recovery. It has been around for about 7-8 years.
Yeah.
I started by just attending and getting a lot of insight in the United States about enhanced recovery and what that means in the United States market, and implementing that in our hospitals. Having a lot of mentors, TJ Gann, over there. And I became more involved in that society, heading research committees, posters, et cetera, et cetera. So been on the board for a couple of years now, and I'm the president-elect for next year. So we're very excited about it.
Isn't that great? I was so excited whenever you told me about that. The ACER is an organization that we've all or been a part of, Top Med Talk Monty and I, for years, and thought it was great to hear that you were taking over leadership there and taking the lead. So do you feel like your leadership style's evolved over the years?
I felt it has. I feel, I do try to listen more than put whatever I wanted earlier on. I thought that was the way. And now I just, I'm a little bit more chill. I'm a little bit more laid back and really listen to others a little bit more than I did before.
Yeah. I think that's one thing. It's like my way is not the only way because I tend to be that way. A little bit of the controlling. Like, I know best. I mean, I definitely know with my children, my husband.
Oh, yeah.
Well, speaking of a little bit to that, the emotional EQ piece. And it's so fascinating. We've talked a little bit about that on Top Med Talk. And every time we bring it up, usually we've all heard of that before. Whenever I was at this conference, I brought this topic up, and there were so many people that had never heard of having, what's your EQ, or talking about emotional intelligence. And I was just kind of floored because I thought, this was a conference of leaders, that surely this would be something that people are talking about whenever we're bringing up the next generation and bringing other people into this fold. And they really hadn't. Kate, you just mentioned how, really exploring your own style and how you communicate is so important. That's really an indicator of a pretty high EQ, isn't it?
I think you're being very kind.
Well,
well, I guess so.
yeah.
But I was thinking while you were introducing the topic that, in fact, I think the variation between men and women is not as great as the variation among people in this issue.
So true.
And in the diversity and inclusion space, now neurodiverse people are another group of people that we have to make sure we include in decision making, particularly about them.
Yes.
And it's everyone's favourite sort of derogatory remark to go, "Oh, they're a little bit, on the spectrum."
On the spectrum. Yeah, they do.
That's
a
a
lot.
popular thing to say.
No.
So I think we're not only talking about normal variation in EQ, but also, people who are in the diverse sort of ends of EQ, often very talented people in every other respect.
Definitely. And it doesn't always, I mean, I've met a lot of people who would say that they are, have exhibit some of the different pieces of being neurodivergent, but actually have really good EQ.
Yes.
They communicate very well.
They may have done a lot of work on it.
But I think you're right. Yeah. But one of the things that I have found really the most fulfilling is going into those conversations where someone would say, "Oh, they're a little bit quirky," and the more that you talk to that person, they're fantastic, and you learn so much about them. And really, it's an opportunity to get to know somebody and understand that you learn a lot about yourself as well. So taking into account your own EQ whenever you are thinking about others in that space.
The other thing I've found as I've got ancient,
Stop it.
is that I think young people, people in their 20s, they're operating on a different
wavelength.
They're in a different dimension.
Yes.
When it comes to this kind of thing, they communicate differently.
Completely.
Can you
get your cell phone out? Text me.
People, yes, talking isn't as popular as other means of communication. Texting apparently is out as well.
Oh, what do they do?
You communicate by sharing, content, from that you've curated from social media. So I worry, it's all my generation's fault that they're in this position. But I worry about...
It's a huge burden to carry, Kate.
I worry about, first of all, how we're going to learn to communicate with them, and how they are going to be moving forward when they have had, into leadership positions, when their style of communication has been just so different to ours.
Yeah. Every generation probably experiences that a little bit.
I guess so. I'm sure it does.
Because my grandparents, they wrote letters and never talked on the phone ever,
Yes.
We were talkers.
We were talkers. That's
We're
right.
talkers.
No doubt
Eye
about it.
contact and talking.
Yeah, absolutely. But interestingly enough, I was in a recent, not conflict, but where we were trying to work with a team, and work on some different things to get the team to come together and collaborate, do some different types of things. It's kind of a change management, adopting a new practice. And most of us who were the leaders and upper level leaders were very interactive. You know, we talked, we were face to face doing a lot of what we were doing in person, but there were a lot of members of this group who were communicating totally by text or by email, exclusively by text or email. And there was so much miscommunication. And from a 30,000 foot view, when we all kind of step back to look like, what is going on here? What is the problem? It's like it was a whole communication error. And it was based on that a lot of folks kind of felt like everything's fine. I'm just, we do everything by text. Why can't we communicate some of these big, ideas via text and email? And it just turned out to be
a total disaster.
A debacle,
right?
An absolute mess. And so, I came in and I was like, okay, let's just take a step back and realize what's happening here and bring out some of those principles of EQ, take a moment to reflect on yourself and how you communicate. And then the things that are being shared with you, is this something that really is as big a problem as you think if you just read 120 characters that someone sent to you on a text? I don't know. I find that very interesting. Have you ever found yourself in that type of situation, Anushka?
I have. What comes to mind a little bit is, we talk about how we are as leaders interacting with each other or with colleagues or with employees. But I also think about how we interact with our patients who are at different age levels and different communication styles. I think that's really important as well as we move forward. To think about how we communicate with ourselves and how we communicate with our patients.
Yeah.
That's going to change very drastically. We're moving now in terms of communication into a electronic mode of communication.
Yeah, it's all digital. I mean, there's so much that a patient might. I had a family member just go through kind of the perioperative journey, and how much was communicated to him via email and text was just incredible. And fortunately, he has someone from the family that understands a lot of this, that I could walk him through it. But just for a normal person who doesn't have any ties, that would be hard. Yeah, we're getting a little bit off piece, but I think it's all topical. For no, don't be at all, because I think that we can totally see how that works within our space in women in anesthesia too. All right, one of the other topics that I wanted to discuss very quickly is this concept of growth mindset. Have you guys heard of that before? Now, so Stanford Professor Carol Dweck, in her book Mindset, talks about this concept of a growth mindset. So I'm just going to read a little bit about how she puts it, because I think she does it much better than I could. But in a growth mindset, people believe that their most basic abilities can be developed through dedication and hard work. And brains and talent are just the starting point. So this view creates a love of learning and a resilience that is essential for great accomplishment. And that ability and intelligence can be achieved through effort. So, someone may say, I don't have a background in finance, but I can learn about that and be competent in that space. And you hear, and tying this back into, well, I guess I should say a fixed mindset is the opposite of that, is that I cannot grow, I cannot learn anything. I get to a certain point in my life, maybe I can't teach an old dog new tricks. I don't know, something along those lines. But I think looking at that from the lens of being a woman in healthcare, medicine, anesthesia, however you want to look at it, as a professional woman, you hear very often that women are overlooked for promotion, they're overlooked for different positions, and that, we hear people say, well, women are just not applying for these roles. Kate, we talked about it, from the journal aspect. And so when I was reading about this and learning about this concept, I thought, this is it. This is what it is. Women sometimes feel in our everyday lives, we can grow and learn, and man, whatever needs to be done, we figure it out. Right?
Yeah. I mean, I think when you mention that, I also think about what Kate was mentioning. often we need to have all our T's crossed and I's dotted to apply for the position or to give a good presentation. We put in the time and effort, and it has to just be on par, perfect.
And I have to have every box checked.
Absolutely.
I had 5 years of this experience, and I have to have this degree and this degree.
Yeah. And I think, I'm totally generalizing, but
It's okay.
but I think men are, they go in and they're like, oh, I think I can do that. Let me just apply for that position anyway. Let's see what happens.
Yeah.
I think I'll learn on the job. And I think women approach it differently. Like, oh, I need this. I need to do this extra training to be extra qualified so I can be the best leader that I can be. I feel that sometimes.
I don't know. Kate, what do you think? As we're sitting here talking, is it a mindset? Is it that I'm either fixed or growth, or is it, we just want to be perfection? That's from personal experiences. So.
Well, you are perfect.
Oh my gosh. Yes. It's so perfect.
We are so perfect.
I think the elephant in the room is who's looking after the house, the children, and the old parents. For sure. And we can change everything about appointment processes and mentoring and sponsorship and we can do all those things. And it's like everything else in medicine. We're not going to change anything unless the societal fundamentals change as well. And that means that women are not being helped to look after the house or look after the children. Their partner is an equal partner in that job. My partner and I do this together.
Yeah. That really feels like that is changing.
It's changing.
Yeah.
It definitely. And it's good.
Yeah.
I think
we hear about paternity leave and more, stay-at-home dads instead of stay-at-home moms and things like that.
I also think, just to add on to what Kate mentioned, is the mental load.
Oh, gosh.
The mental load of just, the shopping lists, the drop-offs, the teachers, your mind's nonstop, with that aspect of things and, taking care of your parents and taking care of those doctor appointments and who's going here, coordinating with nannies. It just never stops, especially when your kids are young. So I think also you have that running in the background all the time, and it never stops.
So how do we change it? Like, what do we do? What do we keep on doing?
Don't give up, Desiree.
keep on doing what you do.
Keep on.
Yeah.
Keeping on.
Keeping on.
Yeah. Carry on. Yeah. What else can we do? We could, give up.
Yeah.
But in one of the sessions I was in, a speaker talked about the importance of the medical profession in advocating for social, for social issues, and for more resources for the medical profession, and using our considerable power as anesthesia professionals to bring about societal change. To call out the treatment of asylum seekers or the fate of gay and lesbian teenagers or gender identity issues or you name it.
Yeah.
That sort of thing. We can get the attention of government and the media about the negative health-related impacts of those types of societal issues. And the same thing goes, for advocating for things that support women to do well at home and at work at the same time.
Yeah. Anoushka, this has been your space. We both, commiserated over the years of working, with the kids, and we have little kids. What do you tell someone that's coming in, up and coming and are dealing with some of the same things that we've been doing? Because I know a lot of times we're like, well, one of the best aspects is that we actually get to be together, and this is it's very comforting to talk to other people who have gone through similar things. What do you tell other people who are coming into this space?
I tell other people to really
other women
to really recognize where they are in life and realize that sometimes at different points in life they won't do everything that they wanted to do, And sometimes a few items on their checklist need to go on the back burner for a couple of moments in time and readdress them. Nothing's going anywhere.
Yeah.
And you have to think of what's important to you at that moment. And that changes for whoever you are, whether it's taking care of a parent, whether it's a child with a disability, whether it's whatever it is, whatever is your priority, and only you will know that, will be what you have to take care of at that moment. And everything else can wait.
Yeah. I think so many of us, and I mean, I've done this. I've just say yes. Yes, we'll do. Yeah, that sounds like a great idea. Let's do that. And that somehow that's going, it contributes to my future success. If I say yes now, I'm learning over the years you don't have to
have to say yes all the time. If it doesn't, I used to say yes a lot when I started, and I used to say yes to items and things that would not contribute to my overall pathway or my goal, which was out of my zone because I wanted to please other people, or I thought it was the right thing to do at the time, but it wasn't in my realm of...
Yeah, it's really outside of the box. So you're like, well, maybe I should do that. And then you look back on it, you're like, I didn't need to do that. Kate, are you a yes person?
I'm getting better at not being a yes person.
Yeah.
And in fact, I was just commenting to a younger woman who I was talking to about how I get asked a question and I think, you know what, I'm old enough now to give them an honest answer.
Yeah.
Like, you can't be serious about asking me to do this thing, The track record you have in hiring someone like me is zero.
Yeah.
So, people are often, this will happen to you if it hasn't already, they need women to interview for jobs that they're intending to give to the best candidate.
Yeah.
It's often to men.
Yeah.
And you get to a point where you have to think about what you want. There are only so many years left in your life. Do you want to spend them doing something that, there's only so many more years your kids are going to be at home. What do you want to be doing while that's happening?
Yeah. I don't know. Well, along those same lines, I hope that we're getting away from, we'll be the token woman on the panel or the token woman for the job. I do feel like that happens quite a bit. And I feel like we're moving in a different direction on that.
So.
Yeah. All right, ladies. Well, I could keep talking to you guys forever about this. And, I love this. It's a very different style than what we, are traditionally like, let's get into the research. This is a little bit more, quite frankly, personal, because, we're talking about our experiences. But I love these conversations. I have grown so much personally from them. So thank you for sitting down and exploring all of this.
Thank you, Desiree. That's what you're going to...
Absolutely.
Thanks so much.
Yeah. Well, if you hadn't heard or checked out the previous podcast, please do check those out. They're at topmedtalk.com. You can find all of our pods there. We have over 2,000 now. And we just cleared, a couple months ago, cleared 2 million downloads. So yeah, we want to thank all of our listeners. You guys are absolutely incredible for supporting us over the last 5-6 years. And hopefully we're going to have some future content that's coming out that's going to be just as equally as good, and more conversations here at the World Congress of Anesthesiologists. So thanks again for listening. Be sure to check us out on social media. You can find us LinkedIn, Facebook, Twitter. We are there. We are just now starting to get into the YouTube space. So go check us out on YouTube. Share with some friends. I know. Who knew?
How about TikTok, Desiree?
Okay. That's where I draw the line.
That's what she says now.
Okay, that's a no for me. I can say no. Anyway, thanks so much for listening, you guys. And again, ladies, thank you. Cheers, everybody.
Bye.
Top Med Talk. Thanks for downloading Top Med Talk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, Top Med Talk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out ebpom.org now.